Lieske Giese is the director of the Eau Claire City County Health Department. Lieske has also worked for the state of Wisconsin in its division of public health. In addition, she's held public health roles in North Carolina and Milwaukee. Malia Jones is an epidemiologist and infectious disease specialist who works as a population scientist at the University of Wisconsin-Madison. She's also editor-in-chief and co-founder of Dear Pandemic. For those of you who have not yet come across this is a great resource for all those questions you have about this pandemic, explained by a large and impressive group of self-proclaimed nerdy girls, esteemed female researchers and clinicians from across the country. And finally, Dr. Depesh Nafsari, who is the president of the Wisconsin chapter of the American Academy of Pediatrics. Dr. Nafsari is also a professor of pediatrics at the University of Wisconsin School of Medicine and Public Health. So thank you all so much for sharing some of your valuable time with us today. Before we get started, I want to make sure we thank Badger Bay Management for hosting today's event in partnership with Wisconsin Health News. Wisconsin Health News is an online nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can do so by leaving your email address in the event evaluation form, which we'll send out after today's event. Or you can also sign up on our website at wisconsinhealthnews.com. I also want to thank our very generous sponsors of the Wisconsin Health News panel series. These important and valuable discussions truly would not be possible without their support. So a huge thank you to Ascension Wisconsin, Advocate Aurora Health, Group Health Cooperative of South Central Wisconsin, Hush Blackwell, Marshfield Clinic Health System, and WPS Health Solutions. And an extra thanks today to Group Health Cooperative of South Central Wisconsin. They are today's featured sponsor. Group Health is a longtime supporter of the Wisconsin Health News panel series. We are very grateful for their support. And here to say a few words today is CEO Dr. Mark Huth.
Thank you, Tim, and welcome everybody. And thank you especially to our esteemed panel today. I'm looking forward to learning from you and hearing from you. As the husband of a former high school teacher, I'm very aware of the impact that teachers and schools have on students' life. In fact, I often tell the story that about the time I was finishing with my daily charting and calling of patients when I was in full-time practice, it'd be 9 or 10 o'clock at night. I would find that my wife was finally finishing with all of her grading and her lesson planning and calling teachers and students. And so I very much appreciate and am very aware of how hard teachers work and school districts work to support that. I'm also very aware of the many services that are delivered via our schools. It's more than just classrooms. It's social support. It's a safety net. It's so many things that largely, for some, may go unrealized and unrecognized. At the same time, obviously, we are in the midst of the most significant health event in over 100 years. And so I'm looking forward to our panel's views on how we return to this very important institution in person in the right way, and how we can continue to support students in a really unprecedented time. So thank you, Tim and Wisconsin Health News, for putting this event together, and I'll toss it back to you.
Great. Thank you so much, Dr. Huth, and thanks to Group Health again for really all of your generous support. So schools across Wisconsin shifted to virtual learning in the spring of 2020 as the COVID-19 pandemic started its initial spread. Since then, many have attempted to reopen, while many of the state's largest school districts have stayed closed. With COVID-19 still at some of its highest levels since the pandemic began, health officials are starting to loosen guidance on a return to in-person classes, and more districts are heading back to the classroom. So just how safe are schools, and what impact are they having on the spread of COVID-19? Also, what health precautions are our districts taking as they bring back students? So we're hoping to tackle these questions and more today. And we have really just a wonderful lineup of speakers with us to help achieve that. As the parent of 3 school-age children in Madison, I have been especially looking forward to today's discussion, as I know our viewers have as well. So I'm going to stop talking and I'm going to hand it over to the people that you have all tuned in today to hear. And Malia, I wanna start with you. So I know that the research, like a lot of COVID-19 stuff, is still kind of muddy. I mean, just a large part because this is still a relatively new topic. But what does the research so far tell us about the spread and transmission of COVID-19 in schools? I mean, how widespread is it, and what are some of the biggest lessons that we have learned since March when schools first shifted to a virtual format?
Yeah, it has been a very interesting year in terms of the emerging science of infectious disease in school settings. Back in March, we knew almost nothing about COVID-19 and how it is spread, in particular in school settings. And so what we had to draw on at that time was our experience with the other major infectious disease that we face annually in the United States, which is influenza. We know that children are very effective at spreading influenza, including in school settings. And so that led to the precautionary measures of closing schools very early on as the pandemic started to sweep across the United States. We have learned considerably more about school settings, but it's been very limited. We've been hampered by the fact that schools are not in session in many places. And so the observations we can make about how COVID spreads in school settings has been really limited by the fact that, first schools were virtual and then we had summer. So really only very recently has good information started to come out, and there have been several very recent studies that have indicated that, just broadly speaking, what it looks like is that community spread drives the spread of COVID-19 in schools. And in situations where community spread is well controlled, schools don't really contribute, in-person schooling does not really contribute to an increase in COVID-19 in communities. Now, there are a lot of sort of subtleties in that general takeaway that I think maybe we can return to, but the emerging evidence, and this is really only having come out in the last, I'd say, 2 weeks, is that school settings, when they're implemented with a lot of good mitigation strategies and when community spread is low, are relatively safe.
Great. So Malia, you have school-age children in Madison as well, pretty similar in age to mine, actually.
Yeah.
And I'll just note quickly, as most probably do know, Madison schools have been virtual all year. It was announced this Friday that they would remain virtual, at least for the near future. And Malia, I know your kids are not in the district schools right now, but they are learning virtually. Do you mind just talking a little bit about how that has gone for your kids and your family, this alternative, this virtual learning?
Yeah, well, I think as for many families, it's gone pretty badly. I mean, virtual learning is no picnic, either for parents or for teachers or for students. It's definitely not the ideal way to get an elementary school education, and probably the same my kids are elementary aged, and probably the same goes for middle school and high school. There are plenty of trade-offs to consider when we think about reopening schools for in-person learning versus virtual learning on both the educational and the virtual sides. For us personally, virtual learning was a real challenge, especially with my 5th grader in the spring. And we made a decision to try a always virtual public school for both of our kids. And that's going okay for my 1st grader, but I'd say primarily because he has his grandmother as his full-time learning coach. She sits with him and walks him through every step of that virtual program. And, I fully understand that is not an option for many families. And so it's probably going better for him than it is for other kids. My 5th grader was a complete failure, and we in November decided to pull him out of the virtual school, and he's now homeschooled. So, it's not going well at all. That said, I still have real concerns in particular about equity issues in terms of reopening schools, as well as, on both sides, as well as continuing with them closed. So I guess I introduced the whole complicated concept for you there, just in my own personal experience.
And that, I appreciate you sharing that personal experience. And that was kind of the reason in asking that. I mean, and it can, impact different families differently, and it can even impact, children in the same families differently. So it is such a complicated decision. So if you had the option to send your kids back to school right now in Madison, with what you just said, would you do it?
We would not send our kids back to school for in-person learning right now. And I can give you a few reasons why that is. One is that the more kids who are in a school, in an in-person school setting at the same time, the more challenging those mitigation strategies that might make schools safer would become. Right now, we have a pretty stable situation. My kids are both doing okay. It's not great. It's not going to be the best year of education they ever had, but it's fine. It's fine. We're getting through each day. And I don't feel good personally about sending my kids to school and contributing to what really is a community level problem when I have a reasonable option to keep them home and keep everyone more safe. And in particular, one of my real concerns, my real worry about schools reopening is that we still don't know a ton about how frequently children are asymptomatic carriers of COVID-19 and how they might end up taking COVID-19 home to especially their older family members in intergenerational households. That is a real equity concern here in Madison, and it's one that I'm personally very concerned about. So that's one reason. The other reason is that I've observed my friends who have, who in other districts who've gone back to in-person schooling, when community cases go back up again, the schools have to close. And those transitions are tough, both on the kids and on the parents. And I just, with all the uncertainty last year, we really needed to have like one solution for the whole year. And so that was one of the reasons that we decided to just go with, make a commitment to virtual learning for the whole year.
So what precautions do you think need to be in place in order to, as a parent, as a public health specialist, researcher, PhD in this study, what type of precautions do you think need to be in place that you would feel comfortable, or do you think other families would feel comfortable to send kids back? Is it just knowing more about it, which we won't until a little later, or can you spread down and all the above?
Well, information is coming out really rapidly. And we also have there are a lot of moving parts right now. One is that we're getting more and more information about asymptomatic transmission and this household transmission that I was talking about, for example, about school environments and what makes them safer. And we also have moving parts around the vaccine. The vaccines, we have 2 vaccines that are very effective, and they are rolling out now. As coverage in the population increases in those vaccines, the risks of sending anyone back to in-person activities will start to decline. And so there's just, it's an evolving situation. There's a lot going on. The question you asked me was what kinds of things would make schools safer. I'd say broadly, and our other panelists will probably be able to speak to this as well. Broadly, COVID-19 is transmitted by sharing air. And the things that we can do to reduce those risks include having everybody consistently wear masks, more space between people, and more air exchange in the rooms where people are congregated. And so those are the kinds of physical plant mitigation strategies that we see going into place in schools. And there were a couple of pretty good studies that came out in the last week that suggest that those do work when community spread is low.
Great. Well, thank you, Malia. We'll come back to you, but I want to move on to Dr. Nassari now. Dr. Nassari, what do you think? How important is it? Is it important that kids are back in school right now for in-person learning?
Thank you so much. And I think everything that Dr. Jones just said and what I'm about to say can probably be summed up by the phrase, it's complicated. There really are indeed, as she said, a lot of moving parts here. In general, what we've found is that children do tend to benefit when they are in-person learning, right? There's the socialization aspects, there's the ability for a teacher to be more up close and personal with what their needs are. And there's a lot of elements to just being around other people. Having said that, as we just heard, it all depends on our communities, right? If we are not being responsible as a community, and that's includes individual behavior, but it also includes kind of what we're doing at a policy level in order to effectively mitigate and control spread. If we're not doing those things, then of course there's going to be higher case rates in the schools. And it's not just about children per se. If you look at the data, children themselves tend not to be afflicted by the virus, by being infected by the virus, except in a relatively small number of cases, nothing like what we're seeing in vulnerable adults. But we know that they can take it home to others. They can take it home to family members and so forth. So I think what's really key here is how do we balance all of this? How do we balance the risk of spread among children? And the other issue here, as we all know, is that schools are not all equal, right? They have buildings and physical plants of different capacity. They have different ventilation systems. They have different classroom sizes. So what solution might work for one school district may not work for the very next school district over, again, depending on all of these factors. So if you look at the American Academy of Pediatrics guidance on this, it's very clear that it is complicated and that it does depend. They do recommend starting with a goal of trying to head to in-person learning, but there's a lot of ifs in there. And I think it's really important that people not just stop before reading the ifs. And the ifs have to do with proper mitigation factors, proper PPE, proper spacing, proper ventilation. All of these things take money and resources. And I think most public schools would be the first to tell you that they already didn't have the resources they needed before the pandemic. And they clearly don't have enough right now.
Thank you. And of course, those resources can vary widely from district to district. But what are some of the overall non-virus impacts of this current situation in terms of the health and development of kids? I mean, the virtual learning, all the screen time, and just the fear and anxiety of being a kid living in a pandemic.
Yeah, it's certainly all of those things. For one thing, I think there's a big risk of social isolation, of not necessarily seeing other youth around your age, except for perhaps your siblings, which is certainly a benefit, but not something all kids necessarily have. You're not also moving around. The physical activity needs, I mean, children are sometimes not leaving their bedrooms or their beds even perhaps for hours on end because they don't have to. There's also something about the dynamic of being online. I think we all, adults included, including everyone listening to this right now, are well familiar with some of the limitations of doing things virtually. Again, it's a great thing that we live in an era where we can do things like this, but it doesn't mean that it's necessarily optimal. We also worry in some cases that there's fewer adults with their eyes on children. We hope for and dream of a world where home is indeed a safe place for each and every child out there. That's sadly not always the reality. And we worry about unreported cases of child maltreatment or neglect, which can also be related to the extraordinary stress that adults are under in terms of the economy, their own employment, their own social isolation, and their own coping. And you see that anxiety and stress and fear can all kind of go up around children. And that, of course, has a carry-through effect onto what children can or can't do. And then, of course, at this time, we're in a northern state where it's cold and people are a little less likely to go outside. It's not as easy to go sit outside with your friends and let the fresh air help mitigate some of the transmission when there's a wind chill and you're wondering why you live someplace where your face hurts.
Thank you, Dr. Sorry, I'm going to come back to you, but I want to move on now to Lieske. Lieske, thanks again for being here. So I know that Eau Claire County Health Department has worked closely with all the school districts in your county, including the county's biggest, the Eau Claire Area School District, throughout all of this. The Eau Claire School District has, and correct me if I'm wrong here, but has been in a hybrid model this year. Could you talk just a little bit, based on that partnership you've had with them, talk just a little bit about why that was set up that way and how it's gone in terms of transmission and the number of confirmed COVID-19 cases?
Yeah, thanks for that. And yes, we have many different school districts in Eau Claire. And I think one of the things that I would emphasize based on the comments previous is that things are different in every school. The ability, for example, for the school buildings to follow those basic engineering practices is very different from school building to school building, much less district to district. Our approach locally as a health department has been really to work with all of our schools, public and private, in Eau Claire County. Eau Claire Area School District is the largest. And from the beginning, walk and talk through with them the basic public health mitigation strategies and what we have learned about COVID-19 as we've gone along. As Malia shared back in March, it was really the opportunity to understand how disease spread was limited. And we still have a lot of gaps. We don't have universal testing, for example, of school-age students that would tell us a whole lot more about how disease is spread in that environment. But we do know, as public health practitioners and working with our schools, that there are some better ways to do things in schools. And in cases where that can happen, and where that is really followed in a very routine and deliberate way, we're seeing less spread. And the focus with our schools has really been on supporting classroom experiences. We know there are additional challenges with all those extracurricular activities and potential spread of COVID-19 in those environments, but in that physical space of being in classrooms, there are some really practical walkthrough routines that have been done in all of our schools. Very basic procedural elements that make a difference, measuring desk to desk, making sure that people think through how do you have transitions between classrooms, how will you do recess, how will you think about lunch, walking through the practical pieces of the school environment, which frankly are extremely complicated. If you're not a school administrator, nobody realizes how complicated it is. And as you walk and talk through the details of that, really wearing face masks, keeping distance, making sure that children are not in classroom experiences if there are potential risks, either they're a close contact or they actually have symptoms. All of those are practical walkthroughs and talkthroughs that we've done with schools. Those schools that are able to follow those basic mitigation strategies, either by using a hybrid model like Eau Claire School District is doing, or by having extra space to physically distance people and making sure masks are worn all the time, those schools are having less disease spread. And we're seeing that in the disease investigation work that we and the schools are doing. The places I worry is when testing is not happening and we don't know about relatively asymptomatic cases, and when there is pushback in those basic mitigation strategies from either parents or certain environments where those things are not being followed routinely. So I think in Eau Claire, we've been fortunate that it's been a lot of communication and a lot of partnership and some just really practical learning along the way.
And how has it gone overall? Has there been many outbreaks in the classes? Has there been, I assume it varies from school to school and district to district in the county, but has there been schools that have had to quarantine or shut down? How's it gone overall in terms of that?
Sure. Yeah, it's been very variable here. And I think most health departments would likely say the same thing. When we've had a positive case in schools where they are really adhering to the basic mitigation strategies, they're making sure that desks are 6 feet apart, they're making sure that masks are worn all the time. We have had many situations where a case in the school has resulted in no close contacts in that school that have had to be quarantined. We've had other situations where entire classrooms have had to be quarantined because of not being able to or following the basic strategies. So we've had a wide variety of outcomes and some disease spread. And I think We also know that, going back to some of those disparity issues, for example, if a child rides a bus environment creates close contact that's different than if you are someone that can walk to school or you're someone that has a parent that can drive you to school. So there are specific circumstances like that that have made a difference in not only quarantining of individuals, but also disease spread. The biggest issue we see with disease spread is really in social situations and in non-classroom situations. And I think that that is likely shared again across the state. It's the non-classroom experiences where we're seeing more disease spread happening, those close contact social gatherings or sporting gatherings or other things like that, where the kind of engineering is not as easy to do or is being chosen not to do.
Great. Well, thank you, Lieske. So I'm going to move on to Aaron now. And again, we'll come back to you. Aaron, thanks again for being here today. As we kind of talked about before the event went live, you have a pretty tough job right now as a parent in the Madison schools. I know firsthand just how much passion is behind these decisions, whether or not to reopen, and how it really it is, as was mentioned today, a complicated decision and a lot of different viewpoints on this. But can you tell us a little bit about your experience in La Crosse? La Crosse schools have been virtual since March, since late March. There was talk of coming back, I understand, of coming back in October. That was paused as cases started to accelerate across the state. But now students are planning to come back next week for in-person learning. Just tell us about how that decision was reached. Why was the decision made to now bring kids back to the classroom in La Crosse?
Yeah, since this summer, we've been working closely with our county health department and our local hospitals to understand best practices and how to respond to COVID and how to educate our students in the best possible way. And I think sometime in July or maybe even early August, we started using the Harvard Global Health Institute's model for understanding risk as it relates to COVID. And so we've used those thresholds for how we're going to educate our students and what the mode of learning would be. And of course, just after September started, we saw a pretty large spike in cases in our area, largely related to the return of our college age population to the University of La Crosse. And so that quickly put us above those thresholds for return to in-person learning. And so we've been in virtual learning ever since. After a couple of weeks, things calmed down a little bit, and we anticipated maybe the daily case rate would get down below that upper threshold and allow us to return our elementary students in person. And we simply just never got there. So we had planned to return, but trying to follow that guidance as best we could, we saw that things were headed in the opposite direction, and we had to kind of abort our plans for in-person learning. To the frustration of some, many, and there were also many who were glad that we were committed to following that model and doing what we said we would do. Since then, things have gone up and down again, and in mid to late December, the Harvard Global Health Institute published updated guidance based on what we've learned about COVID-19 since March, and that guidance now indicates not thresholds for return, but really a lot of mitigation practices that need to be in place in order to safely reopen our schools. And so that's what we're focused on now. Strictly enforced mitigation controls to ensure that our students, when they're in the building, are safe and our teachers are safe. We know that there will be cases that come into our buildings, but we know that with these strictly enforced infection control measures, we should be able to limit the spread of COVID to 0 or near 0 instances.
So thank you, Aaron. So as you kind of talked about the timeline and how the cases have kind of gone up and down in Wisconsin in the area, cases are certainly down from where they were in October, but they're probably higher, at least statewide, they're higher than they were in August, September, when schools are first coming back. Can you talk a little bit about, that part of this decision? are you confident that even though community spread is still pretty high, that you have enough mitigations in place, or how does that thinking work as you've now made the decision to reopen?
So a lot of the mitigation strategies are the things that we've known since day one. Wear a mask, stay 6 feet apart, wash your hands. Those are the things we've known for a long time. The air exchanges is one thing that has been added, a little bit to our understanding. And so, we're certain that we'll be able to get to 6 air exchanges per hour in each of our elementary buildings and middle and high school buildings. And that's certainly something that varies across school districts and across buildings. And so that is definitely an area that, we're looking at closely. If our hospitals are reaching their capacity, if we're seeing spread in our schools, we're going to shut down. That is something we have a responsibility to our community, of course, and to our staff and our students. But if we're able to hold in-person school and transmission isn't being traced back to our schools, and our hospitals are able to, successfully address the incidences of COVID in our community, then we feel comfortable keeping our buildings open. So we continue to meet weekly, with our hospitals, with the health department, to understand how spread is happening. And if we see cases in our schools and that's a source of significant transmission, we're going to have to reassess where we're at.
Great. What's been the response of your teachers? I know in other districts, there's been concern by some teachers, teacher groups, that they don't feel that their specific districts are safe enough for them to return. How have your teachers responded to this decision to go back?
I could probably split it into thirds. I think there's probably a third of our teachers that are really excited. They know that their students learn best in person and they're most effective in person, and they can't wait to get back. I think there's a third that, have seen us following the science and they're trusting our decisions, but, they're probably a little nervous. And I think there's a third that, have some concerns and maybe even some significant health concerns. And, we established a virtual academy at the start of this whole thing, so that all of our students and many of our teachers would have an option to teach virtually and learn virtually throughout the whole school year. So I think that's alleviated a lot of concern. But there are still some teachers that we're working with one-on-one to try and, identify how we can ensure that they feel safe teaching in an in-person environment. And somewhere we just have to find some alternate arrangements, either for the time being or an online version. Our teachers have been incredibly gracious in La Crosse. They have asked questions. They've been good questions. But I also credit our principals and our directors for really good strategies, for good procedures, high quality communication. And I think there's just a lot of trust that we've built up this year. And I think things have been going relatively well as a result.
It's likely that here in Wisconsin, teachers will be amongst that next group that is prioritized for the COVID-19 vaccine. Once that becomes widely available to teachers, will there be a requirement? Is the district considering requiring that teachers and staff get that vaccine to help ensure protection? What have been discussions around that in La Crosse?
We're not going to require the vaccine, I think, until it was, through the final full stages of the FDA approval process. We wouldn't even entertain it. But even then, there's not a lot of vaccines that we require of our teaching staff and even of our students to work in public schools. I think, potentially down the road, if there's a significant enough community interest to do so, I think we would absolutely consider it. But at this time, not required. We are highly encouraging every teacher to get tested. I am really excited for the day we hit that herd immunity threshold of 70 or 80% vaccination. And maybe the masks can come off and we can hug our students as they leave at the end of the school year again. But until then, until things change, we're not going to require it, but it will be highly encouraged of every individual who feels comfortable.
Great. Well, thank you, Aaron. And so, Malia, I want to come back to you with some questions. And I want to shift just for a little bit to the college level. UW-Madison, your employer, and other UW campuses are planning to come back this month as well. We saw what happened in the fall. There was, as Aaron mentioned, a large spike in cases across the several different UW campus communities in the state. Some research has pointed to that leading eventually to greater spread in their respective communities. As a population scientist, what impact do you think that's going to have on the spread of COVID-19 in these college communities? In what ways will this be potentially similar to what happened in the fall? And in what ways, maybe due to new precautions that are taking place, will this be different than this fall when college kids came back to Wisconsin?
Yeah, thanks for that. This is a really important question, and it is one of the moving parts, one of the moving targets that we are facing. As you say, we are looking ahead to bringing back several tens of thousands of college age people and to our various UW and other especially residential campuses are a real concern. In the fall, I think the evidence was extremely clear that returning students to living on campus, especially in dormitories and Greek houses, did lead to a major outbreak in Wisconsin more broadly. There are a number of very, very strong pieces of evidence for that. And looking ahead to doing that all again in a week and a half here, I have real concerns about it. I think it could lead to another major outbreak of COVID-19 in our state. And to layer on that concern, we have a couple of new variants that appear to be spread more easily or more transmissible than the commonly circulating COVID-19 variant that we had before. The students who got infected already in the fall in the last major outbreak may or may not still have some immunity. But there are many students who were not infected. University living populations are nowhere near those herd immunity thresholds. And so, yeah, I have real concerns that we're going to see another major outbreak when students return to those dormitory settings. Colleges are doing what they can, the universities are doing what they can to mitigate those things, but the fact remains that students live in very crowded conditions, and there's not a ton of mitigation that can be done to prevent transmission in those settings. I think that it's a real challenge, and it's something that I'm really concerned about at the community level.
So aside from the new cases that will likely result from kids coming back to college and potentially also the K-12 level, can you talk a little bit, you've mentioned this in previous interviews, that mentality shift that can sometimes happen when parents do send kids back to school, maybe more particularly in the K-12 arena, in terms of how they approach this pandemic, which is still very active in the state and across the country.
So that is, it was one of the things I wanted to follow up on from what Lieske said, that one of the things that we see happening in some cases when K-12 schools return to in-person learning and other things start to reopen, including restaurants, bars, even if the bars are only outdoors, gyms and so forth, is that people start to think that things are getting back to normal. And so they make different decisions. There's sort of a trickle down effect in terms of our decision making when schools are reopen and other businesses and social services are open. And so some scientists have said that one of the reasons that we sometimes see a parallel between community cases and K-12 schools reopening is actually not because of the school environment itself, but actually because of all the other stuff that comes with schools being open, right? So if I can drop off my first grader at school, well, maybe I should go to the gym after I drop them off. That's what I normally do, right? And so all of those other little decisions can aggregate up to having a big community problem pretty easily. We do see, I think fairly strong evidence that kids are not in general super spreaders of COVID-19. We have seen very few instances where a whole classroom got sick all at one time and there was a major super spreading event in a classroom. At the university level, there's been no link to COVID-19 transmission in classrooms. Right. But, as we talked about before, those other settings that we find ourselves in when we're going about our normal activities can turn into a real problem. And so university students, even if they're not transmitting in the classroom, are still behaving like university students do and attending bars and parties and just sharing bathrooms because they live in crowded conditions, right? And similarly, K-12 students and their parents may not be transmitting COVID-19 in the school, but they may be transmitting it in all those other settings where they find themselves. And so I think it's really important for us to think about, if our kids are back in school in person, that needs to be the whole of our exposure budget. We can't be doing a bunch of other stuff and sending the kids back to school. And in addition, you alluded to this at the top, I think it's very important to prioritize. Schools are one of our most essential social functions. K-12 schools should probably be the only thing open, part of the essential services that are open. And so it's not a matter of, oh, if schools are open, then so should be a bunch of other non-essential services. It really should be the priority in terms of reopening.
Thank you, Malia. So I want to move on, go back to Dr. Nassari. Dr. Nassari, you're a pediatrician, you're a professor at UW. You also have a child at the university, and you have a public health background. What is your take on UW's plan to bring students back in a couple weeks? Is this safe? I mean, what impact do you think this could have on the broader community?
Yeah, my son is a freshman at UW-Madison. He was initially slated to live in the dorms, and actually we ended up opting out there primarily because they were being slow to assign him to a dorm, and he was just getting annoyed more than anything else. It ended up being a good move because he's in an off-campus apartment with one friend who's also attending UW-Madison. And they basically, in terms of indoor, it's primarily him and that one friend. So he's actually more shielded than he would be in the dorms. And then his classes, of course, went all virtual after the opening 2 weeks of the semester. And then the option to return to in person was largely not taken up by many instructors. So he's essentially been virtual through all of fall. Spring is going to be largely virtual as well. With he's still waiting to see how that plays out. It's interesting. I think in the not very many number of months, although it can sometimes feel like it's been at least a decade since this pandemic started, how much we've learned about viral spread, right? Initially, I think there was deep concern about surfaces and touching and so on. And while that's probably a factor, it's not the factor, right? It's air exchange and sharing air is the major issue here. We've also learned so much more about how well masks work in terms of mitigating risk and so on. And there's also been time. I'm not going to say we've done great as a nation to actually prepare for the next round of school opening possibilities or whatnot. But being able to scale up testing, and then of course with vaccination just starting to roll out, that makes a difference as well. I think that time will tell. I think there's some interesting differences. Universities can control what happens in their classrooms and to a certain extent, of course, in their dorms. They can't control what happens in communities. And this gets to the point that I made earlier, that sometimes there's a deep mismatch between what policymakers want and what society is saying are issues and concerns, like the prioritization of being able to open schools and open everything else. And there's been a lot of kind of roadblocks thrown in the way at all levels of government, including state and federal. And I think that makes it very challenging for there to be a coherent, unified approach that actually makes sense.
Great. So back to the younger kids, or at least somewhat younger kids. What has the research shown so far on kids getting vaccinated? I know the trials have started, but they, were probably a little ways to anything being approved. What is the research showing so far? And do you anticipate, is it realistic to think that we could have a vaccine for at least high schoolers, maybe middle schoolers by next fall?
So the two authorized vaccines in the United States, the Pfizer and the Moderna, both of which are these mRNA vaccines, one of them only got authorized down to about age 16. The other one is 18 and up. That's not because we have evidence that it's harmful or bad or doesn't work in younger kids. They just weren't included in the initial studies. As you can imagine, there's populations for which it is harder to do any kind of research, including children, pregnant women, other vulnerable populations. People are not usually clamoring to sign their kids up to be in a study until there's usually a longer track record of safety and so on. Most of the vaccine trials are already starting to try to enroll down to at least age 12, and then work their way down. Luckily, as I said earlier, the virus has its least harmful physical effects on the youngest kids. So we can afford to say, well, we don't need to rush to get down there too quickly. The vaccine availability question is an interesting one. So we have these 2 mRNA vaccines. I think it's going to depend on what else. One, can those two, how quickly can they manufacture, and as we're seeing right now, effectively distribute vaccine in a timely fashion. And then what else might get approved? If, say, for example, the AstraZeneca vaccine were to be authorized in 2 months or something like that, suddenly we have many more doses of vaccine available in the general population, right? So that is a net change there. My guess, and this is totally a guess on my part, is are children likely to be eligible to receive vaccines sometime in the summer of 2021? I hope so. There's so many different factors that go into this that it's hard to know for sure.
Great. Well, thank you. Lieske, I want to come back to you now. And you've mentioned this a little bit, but can you talk a little bit more about the role that testing, if any, has played in keeping schools open, and maybe what is holding back further use of testing in at least the kind of the K-12 environment as schools reopen?
Testing is one of our primary legs of the stool, I would say, right now for COVID-19 prevention and control. And it's, I think, one of the basics is that we have shared interest across the community in having people tested. It helps us slow the spread and keep the numbers down. As was described by Crosse, the fewer case numbers we have, the more likely we have teachers and students showing up in classrooms. So knowing who has disease and making sure testing is available for anybody that needs a test and all of their close contacts is critically important. We do have that capacity in many communities now. We are finding that people are choosing not to get tested for a variety of reasons. And I think one of the shared messages we've had with school districts in Eau Claire, we've worked really hard to have messengers from the schools be given the tools to make sure that they are able to talk about why testing is so important. And that's been helpful. I think moving forward, testing is going to continue to be important. And then that critical issue of we aren't testing just because we want to know about that one person. We want to test so that we have a good understanding of how disease is spread in different environments so we can make decisions about those environments is important. Same thing is going to be true with vaccination. Again, shared interest across, not necessarily mandating vaccine, but making it so we all want to have vaccine happen so we can get kids back to school, we can get businesses open is going to be critically important. And then making vaccine readily available to all of those groups as they come in line to get it. So, I think it's been, I can imagine that most superintendents that are on this call now, a year ago, were not thinking about things like testing and vaccinating and engineering of their schools. And now they're full in experts on most of those topics. And we've got a ways to go. And testing will be part of that.
And in Eau Claire, is the testing happening directly at schools? Is it the community sites that teachers and families are being directed to? Where is that testing happening in Eau Claire schools?
In Eau Claire and in many communities across the state, it's happening in a variety of ways. So, for example, here there is some testing that is happening directly connected to schools. We're working with school entities on doing that. We also are having our healthcare providers provide a lot of community testing, as well as the National Guard has a community testing site. And then we do have a UW campus here in Eau Claire. We partner with them right now on doing testing. And actually our Eau Claire School District has been an amazing partner in making their buildings available for things like testing and vaccination. That's another really fortunate situation we have, is schools are part of our community and they've leaned in all kinds of ways to be part of the solution. So in this community, testing is readily available. We continue to work on making sure that people understand that getting tested is important, and working on the challenges where people are actively choosing not to get tested because they don't want to know. And that's a danger in our communities, and we're seeing spread because of that. So that's another place where schools are a great partner with us in making sure that individuals, families understand why not getting tested is a bad idea for the school to be able to continue to operate.
Great. So I want to make sure we hit all the hot button issues and this hot button topic. Claire, like other communities, high school sports are about to resume after there was a pause for fall sports. What precautions are in place amongst these schools to ensure that this is safe? And from a public health standpoint, what precautions do you think should be in place to ensure that this is a safe environment for student athletes?
So our priority has been working with schools to make sure classroom education can happen. We see that educating students in school as much as possible is the #1 priority for our community. We have been working with schools as they've made decisions to restart sports or have sports activities happen. There are safer ways to do it, and we have provided some public health guidance around some basic mitigation strategies that will make it a bit safer. It is the place where when we get a case, we have a whole team that is out of the classroom for 14 days because they're close contacts. And so we know that there's a real impact of doing sports activities by schools. Decisions are being made to do that, but basic things like making sure that regular screening of potentially ill students is happening, as well as coaches, making sure that those before and after sporting practices and event activities don't happen, because those again are places where those close social connections can happen. Making sure masks are worn at all times, and keeping the additional pieces of the kind of fun of sports, the social routine of sports, to a minimum. It's one of those places where we can prioritize classroom and make some decisions to not have all of the trappings around sports happening that might be higher risk because of this specific viral spread.
Great, thank you, Lieske. So I want to go back to Aaron now. Aaron, what is the plan for sports in lacrosse? Are they restarting along with in-person classes? And if so, what type of precautions briefly are being put in place to make them safer?
So we're working closely with our medical advisor and our nurses to follow the procedures recommended by the WIAA and the basic precautions that we know need to be in place. There is still, some residual risk as it relates to athletics, but we're doing what the guidance, we're using the guidance that we have from various places to make the
Aaron, I think you might have froze there. All right, well, we'll come back to Aaron. We are actually close to, Aaron, you there?
I'm back. I have an unstable internet connection.
Okay, well, we will come back to you. We actually are pretty much running out of time. So I want to take the minutes that we have left to have each panelist answer a final question. And for this concluding question, I want you to take out your crystal ball and try to give us somewhat of a prediction on as experts in your respective fields. How long do you think it's going to be till we get back to at least somewhat normal school environment? Are things going to be back to normal by this fall? What do you think, Malia? Let's start with you.
Yeah, so it is really very hard to predict. I think if there's one thing that I have learned over the past year, it might be how hard it is to forecast something as tricky and unpredictable as the pandemic. But I will say that, we talked a little bit about this issue of kids themselves, fortunately, do not experience the worst outcomes from COVID-19 infection. When they do get infected, as a rule, they do tend to recover pretty well, although there are some exceptions. It's not a huge population level issue in children themselves. It's really more the parents and the grandparents and people with high risk comorbid conditions that we're worried about and that we're seeing have these devastating impacts on our community. And so, I hope that the vaccines that we have so far, they're very effective and very safe from everything we've seen so far. And I hope that as more vaccines become available, more doses of the ones that are already emergency use approved, and also more vaccine candidates come to market, we can get those high risk populations covered. And then I would feel comfortable sending my kids back to school even before the children's vaccine is available, if I knew that the teachers were protected, I am protected, and my kids' grandparents are protected. And I really hope that can happen by fall. It depends on, uptake of the vaccines. It depends on a lot of unknowns about how effective the next vaccine candidates are going to be. It depends on this new variant, and who knows what else will come our way in 2021. But it is my hope that I will be sending my children back to Madison Public Schools in the fall.
Great. Thank you, Malia. Lieske, what are your thoughts on that?
So I would mirror what Malia just shared, that there are many unknowns, and our priority right now is to vaccinate those that are most vulnerable. And I think if we can get to a high percentage of the adult population, so really probably anybody over the age of 16 if possible, because those individuals work and are in schools and are across our community. If we can get a high percentage of that population vaccinated, I think we will be in a much better spot come the fall. I have 2 college age students as children, and they both would very much like to be in person. And it will depend on all of us. It'll depend on all of us keeping disease progression as slow as possible until then, and then seeing it as a community decision to get vaccinated, because we want kids back in school and we want to protect one another.
Great. Dr. Nassari, how far away are we from a school environment that looks more close to what it used to be like in the before times?
It's hard to know, of course, as we've just heard. What I will say is to just reemphasize what we've heard said so well just now. The choice is ours. It's ours as a population, as a country, as a community. Even before the vaccines were released, we've had examples around the world of places that have successfully controlled COVID through good public health measures, both at the writ large, level, as well as in terms of individual behaviors like masking, distancing, etc. If we have the will to do that, and then we also have the will to say, yes, we're going to be immunized, then things will happen much faster than they would otherwise. Would fall be lovely? Yes, it would. And I'll add one more thing. I actually don't want to see a return to normal. I'd like to see a better normal. I think there's a lot of lessons that we're learning from this pandemic about education, about teaching, about social connection, about what's possible. And I think we would do well to kind of take the best of what we've learned here as well and try to apply that to our future.
Great. Aaron, we'll give you the final word.
I am excited for the fall of this next year, and I think that as long as we're able to immunize our most vulnerable populations, we'll be able to bring our students back and our teachers back in person. I think as far as returning to what people imagine school to look like, no masks and no social distancing and relaxing some of those things, that's probably later fall, maybe spring even of next year. I think realistically, it's going to take a while. And I think it really comes down to our community's response. Do we want to get vaccinated? Do we want to make the difficult decisions we need to make in order to get there. And to date, it's been a tough go in Wisconsin, and I am hopeful though for the future. And I think next year we'll see a pretty big shift. But I think we'll start off with a school year that might look similar to how we end this school year. And maybe by winter or early spring, we'll start to see an ability to really shift back to some of those practices we used in the past while retaining those new things that we've learned.
Thank you, Aaron. Well, thank you guys for really a wonderful discussion today. Thank you for all that you do. Thanks everyone for tuning in, and thanks to our generous sponsors for helping make today's discussion possible.